An alliance of health providers aiming to improve health outcomes for mothers and babies at risk of preterm birth is launching today in Manukau. About 4,500 births per year are preterm, born before 37 weeks, which is the leading cause of perinatal death and can lead to lifelong disability and poor health. Dr. Lisa Edmonds, no Ngā Puhi Ngāti Whātua, is a neonatologist and senior lecturer at the University of Otago and is with us now. Tēnā koe, Dr. Edmonds. Thank you for joining us.
Tēnā koe. Thank you for the kind invitation.
Now, talk us through is it Karasika Collaborative, Taonga Tuku Iho? How will this alliance work?
Kia ora. So I need to acknowledge, the name of the Karasika Collaborative came from Tina and Tasi, who were whānau who had a baby who was born far too early, who unfortunately didn't survive. And their whānau very kindly gifted that name because really also the thought of this being able to prevent having less babies who are born too early and them flourishing and doing well when they are. So that's sort of where the name came from, and the collaborative, I think, represents the mahi and people's working together, because this is not something that's just done by doctors, it's actually done by our communities.
And what are some of the strongest drivers for this particular collaboration?
I think, as a Māori neonatal doctor, I see little people all the time in whānau, and we know that actually if we could prevent some of this preterm birth, we will also prevent death. So we need to acknowledge those people who are no longer with us. And I think the driver is that there are modifiable things that can change so that you don't need a girl like me, which is always a good thing, but also that it can make a difference, because if we couldn't, not have as many preterm PP come, then actually that's about their lifelong health and well-being, and I think that's one of the big drivers for this.
And what are some of the differences that you see in care and outcomes for mothers and babies born preterm across the country?
Currently, I think it depends on where you live as to what the ability for you to sometimes access care, particularly in our rural and regional centres. I currently work in Ōtepoti, and that's wonderful, but geographically that's a really spread area, particularly if your PP is going to be very, very early. And preterm prevention clinics are not available everywhere across the country. So it varies where you live as to how you can access care, but actually it shouldn't matter where you live. Everyone should be able to have that.
Now, although the total rate of preterm birth in Aotearoa is just under 8%, Maori sit at 9% and are one of the ethnic groups overrepresented in these statistics. Why is this, and how do we help to address these inequities?
Kia ora. It's a really challenging question for sure, because what we know is that if you're a PP and a mama who's of a white ethnicity, then you will have much better outcomes. You're less likely to be born early, and you are less likely to die, and you are less likely to have complete information. And while that's difficult for people to hear, I think it's a symptom of the things that the PMMRC report talked about 2 days ago, about things like structural racism that exist in our health system. And those things impact then on preterm rates in terms of when you're born too early, were you able to access the care you needed? Did you get born in a place that could meet your needs? And for Māori, our rates are higher, and we need to talk about that so that we can get these changes, because actually everybody should be able to have the same outcomes.
100%. So what are the Karasika Collaboration's targets, and how do you expect to achieve these goals?
So we're ambitious, as you would be. We'd like to see, a reduction in preterm birth rates, and a reduction in preterm birth rates for all ethnic groups, because often what happens when you have new health initiatives, it improves for one group but not for everyone. So a 20% reduction, there we go, we have a target.
20.
And preterm birth rate, 20. because that would be a significant amount of whānau who, don't need interventions to come to see a girl like me. And I think that's really important. And we'd like to see 20% improvement in access. Did you get antenatal care? Did you get the right care that you needed before your pepe was born?
Beautiful.
And we'd like to see 20% actually being an improvement so that you're born in the right place.
Let's do it, 20%. Love it. Dr. Lisa Edmonds, neonatologist and senior lecturer at the University of Otago. Thank you so much for joining us today. Ngā mihi.
Ngā mihi. Kia ora.